Alright, so I am going to check the chart and then I will check the physician's orders to make sure nothing will hinder this procedure that's wrong with the patient or anything about the patient. Then I will walk in, provide privacy, wash my hands, introduce myself. Hi, my name's Nadia, I'll be your nurse today. And then I would identify the patient with name and date of birth to make sure I have the right patient. I would then explain to them about the orders that I got from the physician and about the procedure and explain it to them, and then I would ask if they have any questions, and then I would begin prepping for it. So I would bring the bed up to my level, about my hips, and then I would lay the bed of their head lower so they're comfortable. I would put the side railings down on whatever side I choose to do it on so I have more room. And then I would expose the area. So I'm doing a male, so the penis, I would cover up the front half of them, or the upper half of them with a sheet or a blanket, and then the lower half with a sheet or blanket, just exposing the penis. And then I would put gloves on. I would then palpate the distended bladder to make sure there's no pain. Then I would take a washcloth with soap and water and make sure to clean the area super well, and then I'd have to be sure to dry it. And then I can begin my Foley. I'm going to make the bag into garbage. Then I will be mindful of a 1-inch border. I do see that the garbage is touching the sterile part, so that will not be sterile, and I know that. And then same with the 1-inch border this way, it was not sterile. So I will then grab the tip of my gloves and open them. And then it's not touching the box. So, in, then inside, and on. Alright. So now that these are here, 1-inch border. Alright. Now I'm going to grab my drape, shiny part down, over like that. Then I am going to grab this, pull these in towards me, and drop on the erythrometus. Alright, still being mindful, 1-inch border, 1-inch border on there. Alright, and then this blue is a bed pad, just in case there's any drainage or leakage of any sorts. Now I can begin. So I'm going to take out these, make sure this comes around, and drop it on there. Then I will take off these legs, turn around and drop. I can take this out, and that way take this off and then go around and drop it. Alright, so I'm going to connect this saline and then I will begin. So this patient either has his legs straight or has his knees up a little bit, and then if this was a woman, she'd be in a sitting position. So now I'm going to grab one cotton swab, non-dominant hand onto the penis. If this was a non-circumcised, I would retract the foreskin and then clean it that way, but since they are circumcised, I'll just start at the erythromeatus and go around. And then another one. And then the third time. Alright. Next is the lube part. If this was a woman, you'd squeeze the lube Foley into the kit, and then you would dip the catheter in that way, but since this is a guy, you just squeeze it in. You can just let him know I'm just putting the lube in now. Squeeze all the way in, around, garbage. Alright. Now that that's done, we can go ahead and you'll say, okay, I'm about to insert the catheter. Just take a deep breath. It'll be a little discomforting, but not too discomforting or too much pain. If there is that, then please just let me know and I'll stop. On the count of 3, 1, 2, 3. One to 2 inches, and you go 7 to 9. Then you can go ahead, you can put the non-dominant hand to hold the catheter in place while you squeeze the saline in, making sure there's no bubbles. Alright, then you can disconnect, around, garbage. Alright, then you'll pull it, make sure there's retraction, which there is. It means you put it in the right spot. And then you will just ask if they're okay. That is over now. You'll make sure the bag is clean before you do this to be sure when there's urinary retention, it doesn't spill everywhere. You would document if there was urinary retention, how much, if there was any odor, the color of it, and then you would clean up everything. You would tear this drape half and half so you wouldn't go over, you'd go around, and then you would place this tube on the side of their leg. You'd hang the bag on the side of the bed. You'd make sure the bed is back down. You'd make sure the side railings are back up. Make sure the patient's in a comfortable position. Make sure the call light's next to them. Make sure they have no questions and that they're comfortable. And that's that.